Good morning, Peter Goertz. I'm a psychiatrist interacting with suicidal patients. Top priority is safety of the patient and of course yourself, just in case the patient might also be assaultive. So if you're in a clinic setting, if you're sitting in your office in an outpatient clinic with the patient and the patient says they're suicidal, if you think it's an emergent situation, then you really want to make sure the patient doesn't just walk out of the visit. That can happen, has happened, can be dangerous, very concerning for psychiatrists then also. And for example, a patient, this was actually in an ER, a patient was seen in an ER and then this is a while back, after being seen in the ER, the patient left the ER and tried to hang himself on the hospital premises, but what he hung himself from or tried to hang himself from broke and he survived. But still, that type of situation you really want to avoid. So if someone's in your office, outpatient office, and is pretty dangerously suicidal, in your opinion, you want to make sure, if you think they need to be hospitalized, you want to make sure that you have security aware as soon as possible so the patient doesn't elope. You want to, very importantly, you want to do your best to establish rapport with the patient, transmit to them that you care about them, and even with a suicidal patient, sometimes humor can be helpful. Humor can be a very respectful thing. Of course, you're not going to make fun of the patient, but humor really can show that you see the other person, the patient, as a human being and respect them. So you really want to make sure as much as possible they feel cared for, respected, and that of course can help with the suicidal thoughts. One pitfall as a psychiatrist or as a human being is arrogance. So if you're sitting across from a suicidal patient, trying to tell them life is worth living, and they don't have money, they don't have food, they don't have housing, they've been through enormous trauma in their life, that can come across as arrogant. So you want to be careful with how you say things, because it can be easy for you to say life is worth living. The person sitting across from you is, of course, or very often in very different circumstances. However, in my opinion, there's always hope, and you want to remind the person of good times in their lives. Pretty much anyone has had some good times in their lives, so you want to remind them things can change, things can get better, and the stressors that they're dealing with, for example, if it's a child, the bullying, that can change, that can stop. Hopefully, it needs to stop. The money situation for an adult patient can change, for example. In my experience, things pretty much always are not black or white. No one 100% wants to kill themselves. And there's pretty much always a gray area. So there is some interest in life still. And in general, I think the fact that they're sitting across from you in a clinic or an emergency room often means that they have some hope. So you want to remind the patient that that's a very basic thing. You want to remind the patient by your actions and by your words. You can say it outright. No one's better than you. I have my problems as a doctor. You have your problems. We're all just human. Really, the reality is nobody's better than you, no matter what your situation in life is. And hopefully the patient will accept that. Of course, that's more of an intellectual statement. They really have to feel it. So hopefully that can also happen, because it is reality, in my opinion. We're all just humans. We're all in the same boat, basically. You want to remind the patient, of others in their lives who care about them, who would certainly be affected if the patient committed suicide, like children, their pets also. People are often quite attached to their pets. The pets give us unconditional love and are very important. So that can help the patient stay alive if they remind themselves that the pet really is dependent on them and also gives them love. You want to remind the person, if they have spiritual beliefs, of those spiritual beliefs. If they have that belief, for example, that God put them here in this world, you want to remind them, the patient, of that and say, God put you here. Let God say when it's time to take you. Another aspect is often patients, or some patients, are chronically suicidal, which is concerning for sure. But if there's an acute component, if there's something new that happened, if the suicidality has changed, that can be more worrisome. And you want to get an understanding of where the patient's coming from, what acute events may have happened in their lives. And you want to, if it's okay with the patient, you want to contact others like family to help support the patient, make the family aware the patient's struggling, so the family can help support the patient emotionally. You want to remind the patient that there is hope, in your opinion, with, for example, psychotherapy, medication, and changes in their life. More support by the family, for example. Maybe a social worker can help them get other needs met, like housing, finances, food stamps. So a lot of what you're doing is reminding the patient things can change, and they can change for the better. Other options to support and help the patient would be intensive outpatient treatment, psychiatric hospitalization, and another aspect which isn't directly affecting the patient necessarily is you want to be careful with your own mental health, because dealing or interacting with psychiatric patients, period, but also with suicidal patients, if you do that a lot, that potentially can lead to burnout. And you want to remind yourself there's only so much you can control. So you can do your best. You can really try all aspects you can think of, all avenues to try and help a patient, but they might still commit suicide. And that, of course, can affect the doctors caring for those patients. So you want to look at burnout, potential burnout of yourself. Remind yourself there's a lot you cannot control in this life. All you can do is try your best. And that hopefully will help you avoid burnout. Thank you.